Good afternoon, everyone. Welcome back if you joined us from our previous segments, and we welcome in our new viewers for the final segment of Live from Wespath, focused on health and well-being. We are coming to you live from Wespath's headquarters in Glenview, Illinois, where we really have transformed our Wesley Hall area into a studio. And in this beautiful studio, we are constantly reminded of our core values, really important words to us, like trust, mutual respect, teamwork, integrity, as every day we live into our mission of caring for those who serve. My name is Bob Christoffel. I'll serve as your co-host today. I also have the pleasure of being the manager of benefits education here at Wespath.
Welcome again to Live from Wespath. My name is Rachel Miller, and like many of you joining us today, I'm a clergy person from West Ohio, serving as the Client Relations and Outreach Manager here at Wespath. Bob, it's great to serve with you on this third season of Live from Wespath. Can you believe we've had over 1,800 people register and every annual conference represented? We want to thank you, our viewers, for tuning in. Absolutely. Thanks, Rachel. Tremendous interest in Live from Wespath. Our broadcast today featured segment 1, focused on church and clergy, a lot on campus. Segment 2 was a terrific investment update. And this segment is going to focus on health and well-being. Just a few short housekeeping items before we get started into the content. The platform that we're using this afternoon is called Zoom Webinar, and it's interactive. It allows you to submit questions during the live broadcast. We have subject matter experts working behind the scenes that will answer your questions, as well as raise up some of those important questions to share with all the viewers. In addition, hundreds of you submitted questions during the registration process. If you are experiencing any technical issues, audio or visual, you can check the chat function for a Zoom webinar guide, as well as submit those technical questions through our Q&A. We're going to do our best attempt to answer all questions that were asked today. Our third segment begins with It Takes a Village, improving clergy well-being, a really important topic. And with us is Reverend Rachel Miller, my co-host, as well as Dale Jones. And they're going to discuss some really important trends in clergy well-being and highlight how Wespath and, very important, and its partners are facilitating important conversations around systemic issues affecting clergy's well-being. So Rachel and Dale, take it away. We look forward to hearing what you have to say. Thank you so much, Dale, for joining me to have this conversation around clergy well-being. We've talked a lot over the last couple of years about the 2023 Clergy Wellbeing Survey, and in fact, the 2005 results should be back any day now. We've been conducting these surveys every other year since 2012, so what that means is we now have a 10-year look back, and unfortunately what we're seeing is not particularly encouraging.
Yeah, the trends are not as moving in the direction that we would like them to, Rachel. The details of our last Clergy Wellbeing Survey are available on our website. We'll look at a little bit of a summary overview in just a second. But on the QR code that you will see on the screen at some point, that takes you to a web page of clergy wellbeing resources. And one of the links on that kind of goes into detail about the results of the 2023 survey, and also shows the comparison, as you said, of the 10-year history of the clergy well-being trends that have come out of these surveys. Our survey is done by an outside professional research firm, and they apply methods and sampling and numbers so that we can be relatively assured that the results are representative of U.S. clergy overall, and therefore kind of give us a good picture of what's happening with clergy well-being across the 5 dimensions of health: physical, spiritual, social, emotional, that we and financial, that we measure and focus on in our well-being work.
I know here at Wespath, we've been trying to raise awareness around concerning trends that we've been seeing over the last 10 years on overall clergy well-being. And as we look at the next slide, we will be able to see pretty clearly that we're not really moving in the direction we would hope for.
Yeah, this graph shows that across the 10-year period, the number of clergy that have reported their health as very good or excellent has declined from about 2/3 now to about half or so. And conversely, clergy who have less positive reporting of their health, that percentage has increased pretty substantially over this same 10-year period. And if we were to look at, if you were to say follow that QR code and the link and look at some of the specific details, you'd see that in some areas in particular, there have been some pretty significant declines in things like diabetes and prediabetes manifestations, obesity, perhaps in some ways not unlike trends that we would see in U.S. population overall, but as we normalize the data and compare it to comparable demographics across the population, unfortunately, our clergy show up as even greater lack of well-being in some of those areas than their counterparts would be across the population. Another area that has shown pretty significant decrease in well-being and increase in symptoms is like in depressive symptoms, things that could potentially lead to depression. And there, we've been at about like twice the national benchmark, kind of reflecting, I think, Rachel, the challenges of being a pastor, of doing the work of a clergy person in the current setting that we're living in, and perhaps for United Methodist amplified even more by some of the impacts of the COVID pandemic, and then in some parts of the church by disaffiliation as well. So that we see that when we ask particularly questions about impact of the COVID pandemic, more than half the clergy that responded indicated that particularly in terms of their social well-being, their emotional well-being, the pandemic had had a significant or at least moderate adverse impact on their well-being overall.
What are some of the things that Wespath has been doing with this information we've gleaned from the 2023 survey?
Well, one of the things that we have done recently, in addition to continuing to make available resources that we've created in the past, such as our first aid for mental health resource and that kind of thing, but last year we partnered with the General Board of Higher Education and Ministry to emphasize the 5 different dimensions of well-being, to create resources that General Board of Higher Education and Ministry sent out to all of the clergy in their database, information to kind of help address those each of those areas, 5 different mailings over the course of several months. And in addition to trying to provide some help and tips and information, the other thing, Rachel, that was part of that is an opportunity for the recipients to feed back, to comment on things that could be both supportive of well-being and detractors from well-being. One of the things, now, I should have said at the outset, Rachel, and you're aware of this, I'm actually pinch hitting in this segment for Kelly Wittig, our Managing Director of Health and Wellbeing. This is a bit like sending in the utility player with the .220 batting average to pinch hit for the cleanup hitter. But one of the things I've heard Kelly say is that while well-being is related to our individual responsibility, in part at least, I need to do the things that contribute to my well-being and avoid the things that contribute to my not being well. There are some things that are well out of my control, things that are systemic, things that are kind of part of being a pastor in today's setting that despite all of the things that I might try to do to take care of myself, are not really things that I can control or can improve.
And I would totally agree. As a clergy person myself and married to a clergy, we have absolutely see this to be the case. I can have the best of intentions, but if I'm not supported by my church board or my congregation, I'm not going to be able to live into those healthy changes for myself or for my family. So yes, there's got to be a paradigm shift there where we all participate in that.
And the feedback that came in, even though it was just kind of voluntary and it was not the kind of scientific work that we researched that, that we do, say, in the clergy well-being survey, but the feedback that came in from those mailings and questionnaires that General Board of Higher Education and Ministry sent out identified a number of things that both are positive and not so positive in terms of our effect on well-being of clergy. For example, they said it's a good thing, that we have guaranteed appointment, at least those in the categories that do have, that there is a minimum salary set, that we've got some assurance of some provision of job and job security and compensation. And that there are typically good benefits provided through annual conferences and through the denomination, through the work that we do for clergy. But on the other hand, there are some stresses related to that as well. Some of them said that some of the programs and well-being that their conference offers are particularly helpful. And that covenant groups, where they have an opportunity to be part of other groups of other clergy, interact with one another, support one another, that's a contributor that the system makes to their well-being. It's maybe not everybody's experience at annual conference, but some of them find their annual conference sessions to be really positive. One person commented, it's like church camp for adults,
It
So.
is. I would have to agree. I love annual conference, been doing it for about 30 years, but to me, it's the highlight of the year because we come together in person to worship, to socialize, to have ice cream, to make hard decisions, whatever it is. So I look forward to that like I do. It's like a major family reunion.
And the ice cream, of course, in moderation, I'm sure.
Absolutely.
Yeah. The idea that clergy have a somewhat flexible schedule was seen as a positive thing, but if that schedule is 24/7, that's not so positive. They also identified as some of the things that are less helpful. In some cases, maybe they're pretty well isolated. No other clergy, maybe not even family and friends that are nearby, that there are expectations that are just sometimes, through no one's fault, maybe unrealistic.
Right.
And as the spouse of a pastor myself, and you as the spouse of a pastor and yourself a clergy person, you've probably seen and experienced that. The whole idea of the itineracy and the moving can sometimes be uprooting and stressful to families and to individuals. And then where does the pastor herself or himself go for their own pastoral care? The superintendent, the person who has oversight and supervisory responsibility, that's maybe not the individual that somebody wants to be most vulnerable with. So some areas where the system could use some help.
Absolutely. And I think, too, when we think about holidays and isolation and our families, most of us don't live probably close to where our families are. And these holidays are also the high and holy days of the church. So it's a double whammy, not being able to be with family when you'd like to be because your focus is your church family during those times. So,
Yeah, really torn in times like Lent and Advent
Absolutely.
and Christmas and Easter especially. But then kind of coming out of that work last year, we held again jointly with General Board of Higher Education and Ministry some gatherings of key people, some bishops, some district superintendents, some pastors, some lay people, widely kind of diverse groups of 20 or so people, a couple of different gatherings earlier this year to kind of ideate and brainstorm about what are some of the areas where systems are detracting from well-being and where they could be, where well-being could potentially be improved with changes in those systems. And some pretty amazing ideas came out of those conversations. One of the things that was cited is, we have a fairly fragmented human resources model in the church. Pastor parish committees recommend candidates for ministry, and boards of ordained ministry qualify and credential, and cabinets and district superintendents and bishops appoint, and and churches set the salary, and conferences decide on the benefits, and if there would be some way that maybe some of those different things could be brought together more holistically, that could potentially relieve some of the stress that clergy feel and experience. Another thing that, the things that we have measured, the stuff that's in the statistical tables over time, is that really appropriate for today's world, for the kind of postmodern, in some ways post-Christian society that we're in? Or do we need some additional measurements, metrics to really kind of give indication of success and progress in clergy leadership?
We also heard a lot of great ideas in response to the fact that seminary and courses of study don't always prepare clergy for all of the aspects of the job. So we were trying to identify, how can we close those skill gaps in areas like fundraising, financial management, conflict resolution, and things like that would really be helpful to clergy, but we just simply can't fit it into the degree program.
Right. Yeah, we heard a bit of that even from our young leaders, our three younger clergy earlier this morning, the things that they didn't necessarily get in seminary, but then found that they needed when they actually got out in practicing ministry. So ways that could be somehow incorporated into the entire process. Some concerns about compensation and compensation equity. And then the whole question about what could we put in place to get back to what we mentioned earlier, the way to provide pastoral care for the pastor, herself or himself. And then in some cases where conferences have maybe made some real headway in improving some aspects of well-being, how could that be shared and adapted so that it could be more widely used across other parts of the church, so that everybody's kind of not reinventing the wheel or trying to figure it out all on their own, but take advantage of the things that some groups have already learned.
Absolutely. If we could come up with best practices and do that across our annual conferences, can you imagine how much more efficient we would be and just how much better we would be able to run those parts of what the church needs to be doing? So that's very, very helpful. Thank you, Dale. I really appreciate you taking this time to have this conversation, especially in lieu of Kelly being ill. And we just thank you all for tuning in, and back to Bob to see if there are any questions from our audience.
All right, well, thank you so much, Rachel and Dale. Really, really important information. And, Dale, I've known you for a long time, and you are not a pinch hitter. You are the cleanup player, and we thank you for filling in on very short notice on a very important topic and keeping Live from Wespath moving along. Truly a great example of one of our core values, teamwork. So let's go to some of these live questions that we have. You painted kind of a grim picture, but the questions are there any areas where clergy well-being is actually improving? Any positives out there?
I believe the survey showed actually some improvement from 2021 to 2023 in a couple of the key areas, where we were, the 2021 survey, where we were really in the midst of the pandemic, and also getting into disaffiliation. And the other area that I recall that was indicated was there was kind of an uptrend in sort of a focus on overall spiritual well-being, a sense of God's presence in your life. There's, I think, like with everything else, there are challenges, but if this was an easy problem to solve, we would have done it a long time ago. And so there's opportunities and hope as well, Bob.
Well, thank you for that positive message there.
I should have said also, by the way, that Kelly Whittick is the most health-conscious person that I know, but unfortunately, one of her children shared with her the flu bug that he brought home from school. But I know that if there are people out there who are interested in helping move forward progress in some of these systemic things that we talked about, Kelly would be really glad to hear from you.
Thank you for that, and we wish Kelly to get well soon. Second question has to do with the survey itself. Does the survey collect responses from the same people every year, or do they switch it up and try to survey different people each year?
I don't actually get involved or have any involvement with how that data sample or participant sample is taken. But I think without what I think is the case, and we can correct this if it turns out that I'm striking out rather than hitting a base hit on this response. What I think is the case is that the researcher attempts to get a representative sample of participant data so that we can be relatively assured that what we are hearing is representative of clergy overall. And so they oversample some segments so that we have adequate responses from those groups. I would say it's probably not necessarily exactly the same people every year, but it could well be that, that some people receive the survey multiple years in a row.
All right, very good. Dale, now you mentioned the first aid for mental health, such an important resource. What other resources are available to someone who may struggle to prioritize, which we often see among clergy, their own well-being?
From, were you starting to say something,
No,
Rachel?
go ahead.
Okay. From, we talked about this a little bit earlier in terms of financial well-being. We have a resource there that you heard about perhaps in an earlier segment called Saving Grace. We have a number then of health and well-being programs that are part of our health plan that you will actually hear about in an upcoming segment. And then we also have some well-being programs that are available widely beyond the health and well-being program for the church generally.
Excellent. So stick around for that next segment. I want to thank you both, Dale, especially for filling in on short notice. Great information from our viewers, some great interaction and questions. But please know that Wespath is really just committed to keeping you informed and educated on these important topics. As we know, and as Dale mentioned, financial well-being is an important component of those 5 dimensions of our well-being. Compass, which was covered extensively in segment 1 of Live from Wespath, is the new clergy retirement plan, which will kick off on January 1st, 2026. Compass has a really important component which helps clergy if they're struggling to choose between paying off student loan debt and making contributions to a retirement plan. So let's watch a short video regarding that financial dimension of well-being and how that specific plan design can help our clergy next year.
We get it. You have to pay down those student loans, and it's good financial stewardship. But planning for retirement is just as important, and Compass can help you with both. Compass is the new UMC Clergy Retirement Plan starting January 1, 2026. It's a partnership between the UMC and Clergy, working together to build a solid financial future for clergy. Here's how it works. Compass includes the Secure 2.0 Act's student loan provision, part of the federal measure passed in 2022 to encourage saving for retirement. This means your qualified student loan payments count toward earning the full UMC match. Think of it like this. If your annual compensation is $50,000 and you pay $2,400 a year towards student loans, that's 4.8% of your annual compensation, making you eligible for the full 4% match. This means that the UMC contributes $2,000 annually to your Compass account through a matching contribution. But you don't have to wait until your loans are paid off to start saving. Even a small contribution, like 1% of your compensation, can make a big difference. Once your loans are gone, aim for at least 4% to keep earning the full match. With Compass, you can build your future without sacrificing your present. Chart your direction today. Compass, starting January 2026.
I want to welcome into Live from Wespath both Bob Gerlach and, again, Christina Tincher. What can you tell us about the Care Coordination Service?
Thanks, Bob. And it's good to be here with you, Bob, to talk about care coordination today. I'm just going to jump right in. As many of our viewers know, the care coordination is halfway through its 2nd year now, and it has made really great strides. So currently we have 4 out of 5 participants primary participants, 2/3 of participant spouses, and 1/3 of child dependents that are using care coordination, which is really outstanding. So, Bob, for those who maybe haven't used care coordination yet, or for those out there that are just curious to hear more about it, can you give us a little bit of an idea what care coordination is about?
Sure, I'd love to. We partnered with care coordinators really after several years of figuring out what we can do to help people navigate the very difficult arena of healthcare, right? And we knew that people had healthcare challenges that they were struggling to get through, and we also wanted to be good stewards of the plan, making sure we're utilizing the right care and that members are utilizing the right care and have the right care available. Those several years of planning actually included us getting some feedback from our peers in other denominations who have been using care coordination longer than us. And care coordinators, for those who don't know, are really benefit experts and advocates that those covered in HealthFlex have access to. They offer high-touch support, which is really, really important. When you need a care coordinator, you call on the phone and talk to someone, right? And they have everything they need about your claims to help you, or about your situation to help you figure out what your next steps might be. And maybe the thing that I like the most about care coordinators is they take you out of the middle when there's anything that needs to be handled between the plan and the provider. So a lot of times people get stuck when the plan says you need something, and they go to their doctor and the doctor says, I gave them that, right? And by utilizing the care coordinators, you can just explain to the care coordinator what the problem is or what you need, and the care coordinator goes and gets all that done behind the scenes. Maybe they follow up with you on something specific, but you're not left running in circles trying to figure out what to do.
Yeah, so like an advocate, like they're
Exactly.
really by your side on this journey. Can you share maybe a little bit more about who's eligible to use care coordination?
Sure. So we heard in the previous segment that there's some well-being programs that are kind of offered to the church at large, and others that are part of HealthFlex, which is our active plan, our active health plan. Care coordination is only available through HealthFlex. That means that for anyone who is enrolled in a medical plan through HealthFlex, they can utilize a care coordinator, as can their covered spouse or covered dependent children.
Okay, good. And for those who maybe haven't used care coordination yet, or maybe tried it once and didn't know if it was the right thing for them, what advice do you have to share with them?
Yeah, I think that for those who have not used care coordination, if you have any kind of healthcare need that you're even the slightest bit confused about, I would suggest reaching out to the care coordinator. They help primarily with medical, pharmacy, and behavioral health situations. For those who have questions regarding dental or vision or health accounts or any of our well-being programs, those questions should still come to Wespath's active benefits team. For those who have used care coordinators, I assume that the vast majority had a positive experience. That is the feedback that we are getting. If you have had a less than ideal experience, I would want to assure you that we have been working with care coordinators since the inception of the program to make sure that they are aware of some of the intricacies of our program. HealthFlex is a very personalized program for our population, and we have some unique offerings within our plan. And our participants have unique needs. One of the things that we've worked with care coordinators on is making sure that they are keeping participants, members informed of the prior authorization process for pharmacy benefits. This is, it can be a highly disruptive process for individuals, and oftentimes it does take a little back and forth between the care coordinators and the providers before something is resolved. So we've asked the care coordinators to do a better and more thorough job of keeping members informed as to where things are in that process. The other thing that we've really beefed up on the care coordinator side is in regards to out-of-network behavioral health claims. HealthFlex is the most generous behavioral health plan, or has the most generous behavioral health plan that we could put together within our plan. Because therapy and counseling is so important, and since those networks are notoriously narrow, we actually offer the same level of benefit for an out-of-network provider as we do for an in-network provider. Of course, with having that generous of a benefit that is non-standard in the industry, it did require that we have a manual process to have those claims approved at the right level so that members are not paying more for out-of-network claims than they would for in-network claims. Of course, with any manual process, it means you have like forms and documentation that needs to be filled out, and it does take longer. Care coordinators now, in addition to ensuring that members are aware of the longer turnaround time for getting those claims approved, also are helping them to complete the form so that the form is completed right the first time and then shortening the overall time it takes for their claim to get approved.
Yeah, wow, okay. It's pretty comprehensive what they can do for the participants. Is there anything additional you want to add about things that care coordinators can help with instead of contacting Wespath specifically?
Yeah, there's a number of different things that care coordinators can help with. They include things like helping print an ID card, or additionally, and maybe one of the things that's most beneficial to members when they want to efficiently use healthcare and keep their costs down is helping find the lowest cost site of care for certain procedures or certain tests they need to run. The example I like to use all the time is for someone who needs a scheduled MRI. We're not saying call a care coordinator before you go out and get some type of emergency service. But if you have a scheduled MRI, an MRI in the hospital can cost 5 and maybe more times in excess of what it would cost to go to like an imaging center. So care coordinators can help you figure out where to get the best, or where to get the best price for the care that you need.
Yeah, and I think you touched on this briefly, but can you talk a little bit more about how care coordinators can go direct to providers
Yes.
correctly? So kind of removing the participant from having to be in between the provider and the insurance.
Yes, and that's really the biggest difference of what the care coordinators do on the medical pharmacy and behavioral health side compared to what the active benefits team had the tools available to do. So care coordinators can get instant and immediate access to claims data. Oftentimes, this means that if some prior authorization is needed, if some kind of prior approval for a procedure is needed, they can get that handled with the provider before the member even knew, or without the member even knowing that that additional step needed to be taken. In addition, they can help with things like verifying the cost you would have for a service. And then I've mentioned it a couple times, prior authorizations on pharmacy benefits. These can be highly disruptive to an individual, right? Your doctor says you need this medication, and the plan says these are the steps you need to take. And most members don't know where to start with that, and they find the prior authorization process cumbersome because before care coordinators, you had to go back to your physician and say, I need you to give me this information. And then the doctor says, well, I sent that in already. And you talk to the plan, and the plan says, well, I don't have it yet. So care coordinators remove the individual from that process. And I think a lot of people have this idea that prior authorizations are just always denied. What the numbers actually show is that for those who have gone through care coordinators in the last, 16 months to get a prior authorization for a medication, that over 97% of them are approved with the care coordinator doing a bunch of the legwork.
Yeah, so it sounds like care coordination isn't just for someone who's having a tough time maybe navigating healthcare, that there are many applications. Anything else you want to add on there?
Yeah, there's also some very basic things they would handle, right? I think I mentioned getting an ID card, confirming your coverage and the cost of a service, helping you find an in-network provider. Clergy might in the middle of the year be joining a new community, and they might not know where a doctor would be, and so they can ask people within the congregation, who can often be helpful, but sometimes it's easier to just pick up the phone and call a care coordinator and say, I need to find a doctor. This is what I need a doctor for. And then finally, the last thing I'd say about what they can help with, something also very disruptive, is on occasion we find that there are low stock medications or out of stock medications. And many people, their stress level rises when they or their loved ones don't have immediate access to the medications. Care coordinators can help find which pharmacy might have the medication that you need, can help get something expedited if you need it through the mail. So definitely the first place you want to go to with any questions on medical, pharmacy, behavioral health is to the care coordinators. And it's really easy to find a care coordinator. You can call the number on the back of your HealthFlex ID card, or if you log in through Benefits Access, not the way that most people interact with care coordinators, but certainly an option. You can single sign on to your medical benefits and then have secured messaging with the care coordinator as well.
Really, really good information.
Thank
And
you.
care coordination is such an excellent service. I hope you've checked it out. And if you haven't, please do so soon. Let's send it back to Bob and Rachel to see if we have any questions.
Thank you so much, Bob and Christina. As a HealthFlex participant myself, I've had the opportunity to work with the care coordinators. And in some cases, I feel like they really went above and beyond the call of duty to help me. I think it's a great addition to HealthFlex and helping us navigate our health plan. So thank you. Let's jump into some of our live questions that have come in. What kinds of things can my care coordinator help me with? And can they help my spouse or children who are also on my insurance plan?
Thank you. Good question. They can definitely help your spouse and children. My daughter is going to be 13 next month, or in 2 months now. I guess it's not May 1st yet. And so she would not call and necessarily ask the care coordinator specific questions, but I could call on her behalf if there were questions about her claims. My wife can call on her own and has. It's definitely been helpful in my life as well to let her know when she needed a blood draw to contact the care coordinators and ask what the right location would be for her versus, waiting till she got to the hospital and paying 3 times as much. I mentioned a handful of ways that people can utilize care coordinators. The most painful thing for most people is to get help when they don't understand their bill or their explanation of benefits. Those are not the easiest pieces of information about healthcare to understand. And so I really find that if you have any kind of question of why you were charged something, what does this really cost, what is my doctor looking for as they wrote up this test for me, care coordinators can help with all of those things.
Yeah, and we've all been there, right?
Yep.
Yeah, I would agree with you on that, Bob. Those explanation of benefits can be a little bit tricky. Many of our viewers have just made a comment that they've used the care coordination service and the experience has been, and I have it in capital letters, has been great. So well done there. Question, can I ask my care coordinator specific questions about something that my doctor has already recommended?
The short answer there is yes, you can ask them specific questions. While care coordinators, are very familiar with the healthcare industry, and there are times where you might get a nurse that you're speaking to. I would not say that in most cases you're talking to another, or any cases talking to another physician. What they can do is let you know this is what, if it's about a procedure, if it's about a medication, if it's about a test you need, this is what that means. These are your options for where you can get them. These are some resources that are available to you. One example would be, a recent cancer diagnosis, right? And you can think about all the different things that would touch, whether it's for you or a family member, right? I need to start a treatment protocol. What does that mean? I need to get this medication filled immediately. How do I do that? If it's someone in your family, I'm struggling with how to deal with this and how to help this person in my life, right? A care coordinator is going to help with all of those things and find you the resources that you need to get through it in as healthy a way as possible.
Thank you for that. I know one thing that I have found to be especially helpful is, for those that want to call in, they certainly can, or email, that type of thing. But what I found handy is being able to just simply text right through my phone and directly connect with somebody and then get that answer back. So that has been really, really helpful. Another question, how does care coordination save me money? And will this service make HealthFlex premiums more expensive for our clergy?
Very good questions. I'll take the second one first. Will it make it more expensive? it actually does not make it more expensive. It makes healthcare a little bit cheaper. And the reason is because when you utilize care coordinators, it helps the entire plan and all participants operate more efficiently. So really what we're doing is we're cutting out some of the excess costs that would come with certain things, and that directly impacts and improves, lowers the rates a little bit, at least more than what the service costs, right? And then how does it help individuals save money? The biggest is by making sure that you're getting your care at the right site. I used the MRI example and the blood draw example. X-rays would be another one, right? Imaging clinics are much, much less expensive or imaging centers than getting something done at the emergency room or at the hospital, right? Not meant to replace emergency care at all, but for those things that you can plan to help direct you to the place that's going to save you the most money, right? They can also help with, are there different medication options for me, right? I will sometimes ask at the pharmacy when I go to pick up my medication, make sure I'm getting a generic script if one's available. Sometimes the line is too long. And maybe before, if I have a longer drive to the pharmacy, maybe I want to talk to the care coordinator first and say, I just got this prescription. Is this the generic version? Is one available? So there's a myriad of ways that you can save money, and care coordinators can help with virtually all of them.
Yeah, and beyond money, great outcomes, I think, is real important with the care coordination service. Bob Gerlach, thank you so much for this information. And Christina Tincher, we also thank you for filling in on short notice. You're a great teammate as well. If you can sit back, we have a really great video, which for me really just illustrates the personal impact of this care coordination service. So take a look at this.
I went to the doctor for a medical test I thought would cost me nothing out of pocket. Then I got a bill for $4,500. I wasn't sure what had happened, but I knew I couldn't afford that bill. I called Quantum, and Alana was kind and patient with me. She told me she would look into it and find a way to help. She sure did. She figured out the problem and got the whole bill erased. I was worried sick for days, and Alana took care of everything in just a couple of hours. What a wonderful young woman and a wonderful service you all provide. Thank you. You are above and beyond. From Doris.
I started my cancer journey 6 months ago. My care coordinator, Michael, has been there the whole time. He's very helpful in answering my emails, getting procedures approved, and always having kind and supportive words for me. I don't know how people do this alone. Thank goodness I don't have to. Michael truly is a godsend, above and beyond in every way. From Mike. Wow.
Insurance is so confusing. Luckily, there's Shantice. She is so awesome that I just had to tell you about her. She is friendly, funny, smart, and kind, and an A+ person. She helped us understand some really complicated stuff. What an awesome service, above and beyond. Thank you. From Jamie.
My wife needed surgery, and we didn't understand what our insurance plan covered. We were so frustrated until I called Quantum. Drake helped me tremendously. I had a lot of questions, and he answered them all. He was kind, professional, polite, and friendly. He was the best customer service representative I have ever worked with. Thanks for going above and beyond. So sweet.
When our son was diagnosed with type 1 diabetes, we were shaken. But from the beginning, our Quantum Care Coordinator, Scott, has been in our corner. He has helped us navigate months' worth of complicated claims and authorizations. He's made our hard time easier knowing that we can count on him to help us with anything that comes up. He genuinely cares and always goes above and beyond. Thank you, Scott. From Jasper. Wow, that was great.
Helping you is why we're here.
So whether you need help understanding your benefits,
Getting procedures approved,
Accessing prescription medication,
Getting care through ongoing illness,
or navigating your healthcare journey in any other way,
we're here to do the hard stuff.
need help, contact me.
contact me.
Contact me.
contact me.
Above and beyond, it's where we go for you.
All right, welcome back. Our next and final topic of segment 3 of Live from Wespath is going to focus on the support and well-being goals and the resources that are available to you. Joining us is Jody Banaka and Christina Tinsha. What information can you share with us about these resources?
Thank you, Bob and Rachel, and I'm thrilled to be here today with Jody, who is our expert on all things well-being. I know, Jody, we have a variety of well-being programs. Can you tell us who is eligible to participate in those programs, and why is it such an important benefit that Wespath offers?
Yeah, it's great to be here with everyone today. So the HealthFlex Wellbeing programs are available to individuals who are enrolled in HealthFlex, as well as their covered spouses. And what I love most about our wellbeing programs is that there's truly something for everyone, no matter where they are in their wellness journey. Some individuals might be focusing on maintaining their well-being, while others might be living with a chronic health condition like diabetes. There's a variety of focus areas, whether they're trying to lower their stress, improve their sleep, focus on their emotional well-being, take more steps throughout the day. There's a wide range of focus areas that can help each individuals reach their well-being goals. And as an added bonus, there are incentive earning opportunities, which I think are the best part about our well-being programs. So each, the primary participant and the covered spouse, can earn up to $410 annually. So I think that's quite a nice bonus to earn a little cash along the way as you're making strides to improving your well-being and your health.
Yeah, there's really something for everyone. It's a very inclusive offering, which I appreciate. You know, for somebody who's maybe just getting started in their well-being journey or has not yet dabbled in our well-being offerings, where do you think they should start?
Yeah, so first and foremost, I recommend that individuals register for Personify Health. I'll be sharing a registration link in just a minute here. And then I always recommend that folks start with the Blueprint for Wellness biometric health screening, as well as the Health Check online questionnaire. Both of those really do serve as a good checkpoint to assess health status and risk. And if you're not familiar with those, the Blueprint for Wellness entails a blood draw and a few other measurements such as waist circumference, height, weight, and blood pressure. While the health check is just a brief questionnaire that they'll complete in Personify Health, it takes less than 10 minutes. And that's going to ask questions about lifestyle. So how much are you sleeping? What are your stress levels like? How's your emotional well-being? What does your physical activity look like? So it really asks a wide range of questions and how you're taking care of your life and lifestyle things that you're engaging with on a regular basis. What I can't stress enough is the importance of taking both of these together. I do see participants will take one or the other, and it's really important to participate in both of these year over year because they do measure very different things. So by participating in both, you're really going to get a nice, complete picture of an individual's overall well-being, looking at their blood work and then looking at the lifestyle risks that they have. So recommend that both of those are taken together on an annual basis.
Yeah, and I always like when I take mine, the report you get that will really show you how things have evolved since the prior year.
Yep.
Is there a particular order that they should take them in, or what is the timeline?
Yeah, great question. So they don't have to take these in any particular order. They just have to participate in them between January 1st and August 31st. I personally like to take my health check right away at the beginning of the year. I will literally make my husband sit down with me and take it on January 2nd just to make sure we don't forget about it. And then I usually do my Blueprint for Wellness biometric screening in the spring. In fact, I just completed mine a couple weeks ago, so checked both of those items off the list.
Check.
Yes.
And like you said, incentives are the best part. Yeah. So what incentives are associated with the health check and the Blueprint for Wellness?
Yeah, so for participating in the Blueprint for Wellness, each the primary participant and covered spouse can earn $100 in rewards cash. So that will go towards that $410 annual incentive that we'll talk a little bit more about in a minute here. And then the health check's going to be a little bit different, where we're going to ask the primary participant and the covered spouse to complete the health check by August 31st to avoid a higher health plan deductible in the next plan year. So for example, I use myself and my husband, which I would never allow him to not complete the health check by August 31st, but if I completed my health check and he did not, then unfortunately we would get hit with a higher deductible in 2026. If it's just an individual that's covered on the plan, then they would be the only one that would be required to complete the health check by that August 31st deadline.
Okay, so we have about 4 months if you haven't already.
Yes.
So folks, take your health check, go get your blueprint for wellness done. Moving on, I know we have many well-being programs. Can you share more of them with us?
Yeah, so if you take a look at the screen, this is a high-level overview of all the programs that are available within HealthFlex. I do want to draw your attention to the bottom of the screen where you'll see the registration link, that join.personifyhealth.com/Wespath. If you aren't currently registered, this is your friendly reminder. Take a picture of the screen, do a screenshot, whatever you need to do to remember to visit that link to sign up. And then we also have the login link there, and then a note on the benefits page is where all of these programs can be searched and located. So starting from the top, we have the 2 programs that assess health status and risk that we already talked about, the Blueprint for Wellness and the Health Check. And then we've got a variety of programs that improve or maintain well-being. We already talked about Personify Health being the place where you're going to access all of these well-being programs, but it's also going to be the place where you're going to be engaging in a variety of daily activities and wellness credit earning opportunities to earn incentives. And then we also have Personify Health Coaching, where folks can connect telephonically with licensed and qualified professionals on a variety of well-being topics to help them reach their goals. We have MD Live Behavioral Health. MD Live is also our telehealth provider, if you're familiar with that, where folks can connect with a licensed therapist or a board-certified psychiatrist. We have our Employee Assistance Program, which some of you might hear of it as the EAP, where folks can confidentially connect with a professional, whether they want to talk about their emotional well-being, or maybe they have some work or life stressors that they want to pay attention to and connect with someone on that. We also have our OMADA programs, the Chronic Disease Prevention Program that focuses on lowering risk of type 2 diabetes and heart disease. And then the Diabetes Management Program that is available to those who are living with type 1 or type 2 diabetes. And then last but not least, we have good old Weight Watchers, which hopefully many of you are familiar with. I will share with Weight Watchers, there is a fee associated with that. HealthFlex does cover 50% of the cost, which I think is really nice and generous. There's 2 different price points available. So just keeping that in mind, that there are, some fees associated with that, but at a reasonable price.
Yeah, this is really helpful information. Yeah. Are there additional incentives that are associated with some of these programs, or can you share what other additional incentives are available?
Yeah, so this is a nice overview. This chart shows all of the incentive earning opportunities. As I mentioned, you can earn up to $410 annually, which I think is amazing, both the primary participant and spouse. We already talked about the Blueprint for Wellness, where folks can earn the $100 in rewards cash, and then the health check. Something else we haven't touched upon yet are the Personify Health Points. Folks can earn those throughout the year, so between January 1st and December 31st, they can engage in a variety of activities to earn up to $40 per quarter and up to $160 annually. In addition to that, we also have wellness credits. Those are a little bit different than the Personify Health Points, but there's a range of activities across all 5 dimensions of well-being that they can engage in to earn 150 wellness credits for $150 a year. One caveat to the wellness credits is that it is all or nothing. So if someone earns 140 wellness credits, they're not going to automatically earn $140. They will have to earn the remaining 10 wellness credits to get the full 150 wellness credits for the $150. I'd love to spend all day talking about all the different earning opportunities, but I know we won't have time for that. So I'm going to recommend that you scan the QR code at the bottom of the screen. Definitely take a look at the Personify Health Point section and the Wellness Credits section. There's going to be a resource for each of those. that really will serve as a nice roadmap telling you how you can earn the full $410. So we're really giving you the answers right on those resources. Definitely take the time to take a look at those so you can learn all the different ways to earn.
Yeah, there's money to be earned and resources to be used.
Absolutely.
Right? Switching topics, as Rachel and Dale discussed, mental health and emotional well-being is a really important topic, especially in the church right now. Can you share, we clearly have a plethora of programs available. How can somebody who's ready to start their emotional health journey determine which is best suited for them?
Yeah, so mental health and emotional well-being are definitely a priority topic. They have been the past couple of years and will continue to be in the next couple of years. So with that, it can be, we do have a lot of great HealthFlex well-being programs that address mental health and emotional well-being, but it can be a little bit confusing to determine where to get started. So we created this tool. There's a QR code on the screen I'm going to go ahead and have you scan that will serve up a series of questions that will help direct you to the program that we think will be the best fit for you. So it's going to start off by asking whether you're looking for long-term care, or maybe you're just looking to start therapy and just try it out and see if it's a good fit for you. There's also some self-support tools that folks can engage in at their own convenience. So you'll go ahead and select, which option sounds like the best for you. And then it's going to ask questions around whether you want in-person care or virtual care. We know, especially around COVID, the importance of incorporating more virtual care options into our HealthFlex wellbeing programs, and we've added a lot over the past couple of years, especially for folks who live in more rural areas where maybe they have to drive an hour plus just to do an in-office visit. So someone might want to utilize that MD Live Behavioral Health where they can connect to care virtually. And then, there's a variety of those self-support tools that they can just do at home in their own time. So you'll answer those questions, and then it will recommend what programs fit best on, based on what they've checked off. And then they can click on each program, learn all the details, and better understand how to access them.
Yeah, really important resource to determine what sort of level of care you need and where you can find it.
Yeah.
Well, thank you, Jody. That was very good. I'm going to now check in with Bob and Rachel to see if there's any questions from our audience.
Thank you so much, both of you, Christina and Jody. I actually did my blood draw yesterday for Blueprint for Wellness, so I'm ahead of the game. And as a reminder to all of you, please don't forget to open Personify Health so you get your steps. And another encouragement I want to offer is EAP. That is an amazing service. I've been taking advantage of that for a couple years now. And it's helpful to have a sounding board when there are things going on in your life that make things crazy. And I even do it via Zoom, so it actually fits into my crazy schedule. So I just want to encourage you to take advantage of the resources that are here to help us in our overall clergy well-being. So now moving on to some of our questions. The first one is, I'm a recent retiree enrolled in VIA benefits. Will I still have access to the well-being programs? I retired in January 2025 and on Medicare and supplements through the VIA benefits.
Yeah.
So my Personify account, I guess, was canceled. I called and they said, because I'm retired, I'm not qualified to participate. So is that accurate?
Yeah, so some conferences do opt into allowing their VIA benefit retirees to continue to utilize Personify Health, and some conferences also allow their VIA benefit retirees to utilize Quest with the Blueprint for Wellness. I recommend, if your account was canceled and you're questioning if you're eligible to continue using Personify Health, check in with your conference benefits office, and then you can always connect with Wespath's active benefits team. And then we can check out your eligibility and make sure that everything's set up correctly. If you are supposed to have access and your account was canceled, we'll go ahead and take care of that and make sure we get your account back up and running.
Okay, great. I'm going to combine these next two questions. They're kind of similar. What is the higher deductible penalty for not completing the health check by August 31st? You mentioned you and your spouse both have to do that. And the second part of that is, my spouse and I have just enrolled in HealthFlex. Are we still required to complete the health check this year?
Yeah, so to answer the first part of the question, there is that higher deductible penalty. So for individual plus spouse coverage, it's going to essentially be a $500 surcharge. And then if it's just individual coverage, it's going to be a $250 surcharge. So make sure you take that health check by August 31st. I'll give you that reminder one more time. And then for individuals who enroll in HealthFlex, prior to April 1st, you will be required to take the health check by August 31st to avoid the higher deductible. Anyone enrolled after April 1st is technically not required to take it, although they can still take it, and we do recommend they complete it so they can assess their risk with their lifestyle. As an added bonus, when you complete the health check, you can also earn 35 wellness credits, so it definitely doesn't hurt to take it, even though that first year you won't be hit with that higher deductible penalty if you forget to take it.
Thank you, Jody. One more quick question before we draw this to a close. How do we connect with the Weight Watchers program?
Yeah, great question. So as I mentioned, you'll want to make sure you're registered for Personify Health. Otherwise, you can go ahead and log into your account and click on the Benefits tab. Depending on if you log in through your app or through your desktop computer, the tab might be at the top or at the bottom if you're doing it from the app. And then you can type in Weight Watchers in the search bar at the top. That will take you to the Weight Watchers homepage or card within Personify Health. And then you can click on the Start Now button, and that will take you to the registration page and serve up those two price point options that are available to you to sign up for.
All right, Jody, if we have time for just one more hot off the press. I am retiring. If my wife stays on the conference insurance, does she still have to take the health assessment to avoid paying more for insurance?
Yeah, that's a really good question. We get this a lot because there can be a little bit of confusion, but as long as an individual's enrolled in an active plan, yes, they are required to take it. If their spouse is the one that's retired and no longer in the active plan, they will not be required to take it. We do try our best to send several communications out to individuals who haven't taken it as it gets closer to the deadline. So always read our emails. I know sometimes you get a lot of emails throughout the day and it's easy just to throw them in the trash, but we will send those frequent reminders so you're well aware that you'll still have to take it if you haven't yet by that August 31st deadline.
Yes, I get those reminders as well, and I think they're very helpful. Thank you both for joining us for this last segment of Live from Wespath, focused on health and well-being. We really appreciate you being here, and I find this information just really helpful for our participants.
In relation to teamwork, our core value on display behind me, I want to thank all of you who were involved in making this live broadcast possible. Our subject matter experts, content managers, our communications staff, and staff from facilities, events, and IT, along with some of our colleagues that have presented today.
Yeah, true. This is a big endeavor at Wespath. We have about 60 people involved, both those on the camera and behind the scenes. Thank you for everyone here on the production team to put on a flawless broadcast. I really appreciate that. And for our viewers, we do this for you. And whatever your role is, if you're active clergy, retired clergy, a surviving spouse of clergy, or a lay participant, I thank you for your service to the UMC, what you do, your ministry, and for how you care. And we will continue our mission here at Wespath of caring for you, caring for those who serve. So signing off from our Glenview headquarters, this is Bob and Reverend Miller. Thank you so much for joining us today.